Hi there. Welcome back to my channel or to my channel for the first time, whatever it may be. I'm Sean Osterlink. I'm a licensed clinical mental health counselor, and I wanted to talk about counseling worldviews. Now, this is going to be brief and very general. I really just wanted to hit on this a little bit. I uh, I like to do a little art here and there, and so I did these little drawings to convey that really everyone has a lens, everyone has a worldview. As therapists, we are meant to be very conscious of our own worldviews and the risks of imposing our own values and biases on clients and doing our best to not do that because that's always a risk. Because again, we always have a lens. And so the best you can do is be very mindful of what that lens is and do your best to stay within what the client needs, where the client is at, how you're using your own therapeutic lens, your counseling theories, and things like that to guide your treatment. But let's talk about some major, I'm going to say like a major shift that occurred in the counseling world at some point in the past, I don't know, 15 years or so. Maybe that, and don't quote me on that. I'm just being I'm vague there. It's happened at some point in the last couple of decades where there was a shift. And so I'm going to talk about that. But these were just some questions I wrote down. What lens or theories are you looking for in a counselor, in your therapist? Do you recognize your own lens, your own worldview that you have? What is in your worldview? What assumptions shape the way you think and see the world? Those were just some questions I had as I was thinking about this topic. And this guy sitting in the seat here in the picture, this is meant to be like you're sitting at the eye exam and they're like changing the lenses out, and it's like better or worse, better or worse, right? How do the beliefs that you have and that you've developed about the world and as they've changed, how do those beliefs, those lenses, help you in your mental health? How do they help you in your psychological well-being, in your relationship functioning, and finding meaning and purpose in your life? Like, how do those things affect you? Because the lens that you wear is going to affect you. If you have glasses that are the wrong prescription, a bad prescription for your eyes, that's going to negatively impair your life. So, getting the right prescription for you, finding that right lens and right fit, and that lens really, as with optics, as with glasses, that lens that is best showing you the world as closely as it really is, that it's showing you something that's real about the world, that if you reach towards something that you're seeing, your hand is going to come in contact with the reality of that thing. If your lens is distorted, if it's not seeing the world clearly, if it's showing you different colors that aren't there, if it's showing you weird squiggles, if the magnification is off, things could be fuzzy. There's different ways that then your view of the world is going to be distorted. Then that could cause problems for your life. And so what I'm going to compare here is that I'm lumping things together in here in the traditional, I'd say like the traditional view of counseling. This is a um, pre-critical social justice, pre critical theory being applied to the counseling world and psychology world. So before that stuff came into mainstream vogue, let's say, there was a view that didn't involve that wasn't coming from that worldview. And so I'm going to describe just very briefly here the differences, at least as I see them. Please look into this yourself, decide for yourself, do your own research. I'm going to caveat all of that there. Right. This is very, very general, and it's coming through my own lens here. So the more traditional view of counseling would be that the client, as far as how you look at the client, is that the client is shaped and impacted by all levels of society. There's biological factors, family factors, culture, policies, systems, beliefs that are all shaping the individual. All of these things. It's like the biopsychosocial model. The individual is being shaped by all kinds of things, from the genetics of the parents to the formation in the womb to childbirth to early socialization and attachment, through just the developmental phases of a child growing up and the social experiences they have and what kind of upbringing they live in, and all of those things. They're all factors, and you want to understand how those different factors come into play in shaping the individual. And that the center of change, counseling is individually focused. You're working with the people in the room. The center of change is with the individual, and the individual benefits when they view themselves as more as capable and not as victims. Okay, so that there's like this shift, and I get this from like that trauma training stuff. There's the um, model of like there's the victim of trauma, let's say, and they can become the survivor. And then ideally, you want to get them to move to thriver, that they're really thriving in their life. I remember that, I don't know, from textbook or training back in grad school in the day, but that moving from victim to survivor to thriver, and how they view themselves and how they're operating in the world. And so you want the client to more and more see themselves as this capable person. They're capable of changing their circumstances, changing the things in their life. They're being empowered. And okay, so that problems essentially, let's say mental illness problems. While there's stressors, of course, impacting that the problems are essentially internal within the person, and or within, it could be within the immediate systems, it could be within family systems, it could be problems related to systems of work, right? Systems absolutely come into play here, and they're but ultimately the work is involves the individual and are resolved by making personal changes and taking personal responsibility. Like ultimately, only the client can change. It's not the therapist's job to change the client. You work collaboratively together in order for the client to change. And I'm going to say a lot of that, I, I, I would think, carries over into the other lens over here too. But there's a difference in emphasis that happens here. So as critical theory, it's rooted in the Frankfurt School of Thought. These were like psychoanalysts, Marxist type guys over in Europe back in like the 1930s and 40s. They're at the, I think it's Herbert Marcuse and some other guys. They're really the foundations of where critical theory came from. And so ultimately that brewed in academia and brewed as far in the form of like critical theory applied to law, and then it came into the psychological field, the counseling and helping professions, as social justice, critical social justice, that view. And it's a lens based on looking things through power relationships, power dynamics. And so I'm going to talk about that here. So here's the lens. This is a new lens. You could say maybe this lens is stacked over the traditional view, because um, I think most therapists, I'm going to generalize, I think most therapists would agree with the things on the traditional view in ways, but really the critical social justice view over here would become the what superordinate, I don't know if I'm using that word right, it would become the predominant thing, it would become really the more important thing. People are going to disagree about that. It's going to really probably go person to person. I'm going to close my blinds here. It's a cloudy day and the sun is suddenly shining through right into my face. So this is going to vary, but as far as counseling training goes, this has become highly emphasized. And I mean, if you haven't been living under a rock, this has become huge in the mainstream culture and in everywhere. I'm not naive to that. It's part of my profession. This is a major thing, right? And so this lens, this lens is how I'm describing it. You can disagree with that. You can disagree with my descriptions here. Okay, this is a brief summary of my understanding of it. So again, do your own research, make up your own mind. But from the critical social justice view, the client is shaped predominantly by things like group identity, race, sex, gender identity, class identity. This all interacting in what is called intersectionality. It's power dynamics between oppressors and oppressed. And this was a Marxist. This came from Karl Marx, that he viewed all relationships in the world as oppressor and oppressed. It's not a view that I share. I think that is a toxic sort of view, because even right now, that would mean this interaction is that I'm either oppressing you or you're as the viewer oppressing me. Does that make sense? Like somehow there's oppression going on in every aspect of society. I don't agree with that. I'm sure people would disagree about me framing it even in that way. You know, if you're in interaction with anybody else, that's that I mean that's a system going on there, right? And as therapists, we need to be mindful of power dynamics. Power dynamics certainly are an element in interactions with other people. Certainly, you want to be mindful of that. Certainly, that is a lens that one can have. You can be like, you can put on the lens of what is the power dynamic going on in this relationship? What's the power dynamic that goes on in the individual counseling session? The therapist is considered as having more power than the client does in that interaction. You can look at things through that lens, but ultimately, it is just a lens of many different things. It's like, in my mind, it's like you could look at different aspects of light spectrum. You could look at infrared. You could look at ultraviolet. You could look at X-rays. You can break it down like that into different layers. You can look at things through a cognitive behavioral lens where you're looking at the thoughts and the emotions and the physical sensations and the actions and the consequences and breaking something down like that. You can look at it from an ACT perspective where you're looking at how is somebody getting too hooked on their thoughts. They need to take more of a metacognitive view. How are they avoiding things in the present rather than connecting with the present moment and pursuing their values? You can take that theoretical lens and lay it over what is going on with the client, what's going on in this situation. Okay, so lenses can be useful. This can have a role, right? But what is what is the usefulness of it? How is it serving? Where does that lens go in the layers of glass you're going to have on, and how you look at a situation? I think all of that is relevant and good food for thought and self-reflection. But what I wrote here is, while other factors exist in this critical social justice lens, the most fundamental is ultimately to view them through the lens of power, is to view the client through the lens of power dynamics. I wrote here that essentially this view would be that the individual benefits via consciousness raising. So it could be things like racial consciousness raising. I remember this from my multicultural textbook. It would be the sense of someone becoming aware of really this lens. It would be the consciousness raising of viewing the world through the lens. So it would be called consciousness raising. I would say it's developing this new way of looking at the world. And with that comes that you're either an ally to this, essentially a repentant ally, that with recognition of where you fall in the power dynamic, are you in the oppressor role or are you in the victim role, then determines, as you develop that awareness, you either become the repentant ally of the oppressed as the form of healing, or you become the empowered victim, that you view yourself more in that role of realizing how you've been victimized by society, by the oppression of society, and that you are then empowered from that, that you didn't have the critical theory-based lens of power dynamics now, but you didn't have it before. You didn't view yourself as a victim of the societal system, and now you do view yourself in that way. You do view yourself as systemically and systematically oppressed by society, and that because of that, then you're empowered. Okay. Again, that's not a view that I shared, because to me that seems confusing, that you'd be empowered by that. But for the people who subscribe to this, they view this as empowering. That it leads to then being that the client, that the person whose consciousness is raised, would be ready to advocate for socio-political changes, right? So to become the activist that is going to then go out into the world and make changes at the societal level. Okay, that basically problems are societal rather than within the person. The blame, rather than on this side, on the traditional side that I put here, that it's taking personal responsibility. On the critical social justice side, the blame is externalized. It's society essentially that needs to take responsibility and change, rather than the client. The client becomes the self-advocate for that change. And so the distress that the client has experienced, that they came to for therapy, is resolved by society changing. Okay. Now there's thus a clash, as I see it, in these worldviews. Okay. On the traditional side here, the views that the, it views, again, this is my opinion here, that the traditional view of counseling would view the critical social justice lens as fomenting cognitive distortions, things like dichotomous or all or nothing thinking, catastrophizing. I mean, viewing oneself as oppressed is a very catastrophic form of thinking of things. That it heightens like looking for oppression essentially everywhere, because that's what the lens says, is that there's oppression all around you. You haven't seen it before, and now you need to see it. And so that sounds kind of akin to the hypervigilance that would come with trauma, right? Is, oh my gosh, I didn't realize I was being oppressed by everything around me and the way everything works. Now I'm going to see it. Is that going to lower your stress in life? Is that going to help you function better? Is that going to make even more stress in your life? Now, all kinds of things that weren't triggers for you now become triggers. Now, the critical social justice view would view that as, but now you're seeing reality as it is. So it's okay to be triggered by that, because now you can address it and do something about it, right? Now you can be empowered to fight against those things, to change them so that they're not triggering for you, right? These are very, I mean, they're very different worldviews here. That the traditional view over here would view the social justice view over here as basically casting stereotypes onto clients, that it would mean looking at their race, their class, their sex, their gender, etc., things like that, and lumping them automatically into groups, as seeing them as either oppressors or oppressed. And that doesn't, to me, seem like a healthy way of viewing clients. I want to view every client as individual. I don't know their story until I'm getting to know them. I don't know what kind of experiences of prejudice or discrimination or things that they've experienced until I'm hearing it from them. And so, I mean, the critical lens could be useful in exploring that. At the same time, I wouldn't want to put that on them. You know, it's one thing if they come from that view and see things that way, then I can come into that with them. At the same time, I don't want to impose that on them. I don't want to create something that isn't there. But that's, again, that's the disagreement, because the person who does really does take this on, does truly believe this, views it as a good thing, that this is justice, that this is good, that this is what people need. Um, and so again, that finally that this causes that this would then cause unnecessary distress. That essentially, if you're um, explicitly or implicitly putting your worldview onto the client, putting in this case the worldview would be that they're oppressed, they may not even know it, and they need to know it even more. That would be the implicit bias that's baked into counseling, training, and education and stuff these days, and has been for years. Is and that that's just the right thing to do, to view things in that way, that that's really what's true. And so it's easy to miss that that really is a lens. That's a starting point of looking at things. And so you want to be careful in how you're doing that. You want to be careful, even in the lens that you use, that even if it's a useful lens, like what's it going to do as you use that with a client? You want to be mindful of that. I'm just as a Christian counselor, I want to be mindful of, like, if I'm not working with a Christian client, I want to be mindful of how I approach this, the things that I say, how I view and frame this client. Like they're not coming from the same worldview as I am. Um, so you want to be mindful of these things. That would be its own episode as far as thinking about that. Now, again, the social justice, critical social justice view over here would view the traditional perspective of counseling that I've laid out over here as missing a large chunk of things, basically, of missing the larger system of oppression going on. It's missing the forest for the trees. It's looking too narrowly at the things in the person's life while missing the big systems of oppression going on, and that if it's not addressing them, then that it results in blaming the victim. And that would be harmful for the client instead. So both sides would view the other as being harmful in this way, right? The traditional lens would view putting on a perspective that's going to induce more cognitive distortions, create more victimhood in a client, and be unempowering, that would be harmful to a client. The critical social justice view would go, well, if you're not looking at this from this big system of oppression sort of lens, you're not really dealing with the problem. You're putting too much blame onto the victim. This blame needs to be put on society, and they need to be empowered in that way. And that ultimately, if you're not doing that, then you're a part of the oppressive system. Then you're continuing that oppression, that even you're oppressing your client in that way. Again, that view that even from this critical social justice view, is that everything is power dynamics between oppressor and oppressed. And so even the counseling session then is a dynamic between an oppressor and oppressed. And again, I think I'll finish up with this, is that's one of the reasons why I wouldn't subscribe to this. Not to say that there isn't something valuable here. Certainly knowing that this is a big movement in the culture, that as this came out of academia, a lot of people have really attached to this. I mean, I know millions of people see things in this way, and for them that it's very, very true. And how could you not? And even that you could be a bad person or you're a part of the system by not believing it. But when it comes down to it, I don't think it's healthy to view a counseling session itself as a dynamic between oppressor and oppressed. I don't think viewing a relationship between a couple as oppressor and oppressor and oppressed, or the people in a family as oppressor and oppressed, um, or to view certain clients as oppressors, and to view certain clients as oppressed. That to me is very much, well, would be like a form of stereotyping and bias, that's not fair to the client and their individual experiences in the world. I want to know, what are the dynamics that are really going on in the client's life? What are the roles of things going on in society and in their social circles and their family and systems? And what are the roles that are going on individually with them? And what's their stake in it? Ultimately, to get at, what can they do about it? What can you, the client, do about that? That's I mean, that's the part that you can control, and therapy is an individual process. So all that to say is, I just thought this was a thought-provoking sort of thing and conveys the way that I work in counseling. So this just gives some more and lets you know, like, what are you looking for in a counselor? Are you looking for that counselor that takes more of that overall big critical social justice sort of view? Are you looking for somebody who really aligns with that, who's going to work with you from that perspective, who is going to, that you know, is going to really believe that perspective from you? Are you looking for someone who's going to more lean into that traditional view where, yeah, systems are a part of it, but more of the immediate systems of your life, from your family of upbringing, your friends, your social circles, those experiences, really those more obvious experiences that one can see, that don't really require a theoretical lens to identify, right? The critical social justice is coming from really a lens first, looking at it. How do we put these things together and say, this describes um, this describes the puzzle of reality, versus the traditional view of counseling is more focused on, well, what's going on in the person's life. How can we get at looking at those sorts of specific and individual details to understand them, rather than presupposing big systemic sorts of ways of looking at it. What were the family relationships like? What was the attachment like going on growing up? What was going on in friends groups and in schools, and different things like that? And what's going on in the intrapsychological realm of the person, and how do they learn to adapt in dysfunctional in ways, or maladaptive ways that kind of maybe made sense in the moment but are no longer working, are becoming problems in the person's life. And where do the two come together, right? Because it's not as if racism doesn't exist. It's not as if systemic problems in society don't exist. But they're different lenses of how you view them, and how it's like, where do you put the piece of glass, and how thick of that glass do you make it in how you view things? It's like both of these can matter, both of these can provide useful insights potentially, but how much are you viewing it? And really, where even are you putting that lens, right? Because you could look at it from, well, there's a systemic problem here, but maybe the systemic problem that you view it as isn't the same systemic problem that somebody else views it as, right? There's different ways of going, what are the problems at societal level? How does that affect people at a societal level? It's not just like one camp. I mean, really, like the critical social justice view would just be one manifestation of a systemic lens that you could take too. So I digress. That's what I wanted to say here. I thought with how big that is in society, with how contentious it is, um, I thought it would be something cool, something kind of interesting to talk about, and hey, raise the consciousness of the viewer to think about, what is your own lens? How do you look at the world? What are the assumptions that you make? What would you be looking for in a counselor? What kind of assumptions are you looking for in a counselor? How do you want them to view therapy? What kind of lens are you looking for them to view you by? What kind of theories do you want them to be bringing into the practice of the practice? I don't know. So that's my thoughts on this. If you like this kind of thing, I plan on making more videos from time to time about different stuff. I may talk about this some more because it's so big and contentious. But from there, that's what I've got for you today. Again, do your own research, form your own opinions. This is my perspective on it at this moment of time, and that's what I've got for you. So thanks for watching, and I'll upload some more stuff in the future. Thanks. Please see the following disclaimer. The views on this channel are solely my own for educational purposes. They don't represent my employer or any other entity. The channel does not create a therapist-client relationship and does not constitute medical advice, diagnosis, or treatment. Any suggestions or recommendations are used at your own risk.